Hey, everybody. It is Coach Bill Hart coming to you live with my very first podcast live. So I'm super excited about that. Stoked, as we like to say in Southern California. Love for you guys to chime in with your comments. If you are there, let me know that you are there just by commenting, and that would be fantastic. And I am going to bring in Dr. Drew Lawson, who I am going to introduce in just a quick second. Well, let me introduce him now. Here we go. Hey, Dr. Drew, can you hear me?
Can you hear me?
I can, but not the way that I was hoping to. Stand by just a quick second. Let's do this. Let's switch over to audio and get that. No, that should be working. Speaker through the Sennheisers. Okay, how about now? Talk to me, Drew.
Is that good, or do you want me to put headphones on?
Try the headphones if you don't mind. Are those going to be your QC35s?
Yes.
I know things. How about now? How do you sound?
Okay.
Is that better?
It is a little stronger, I think. Yeah, that's good. That's
okay.
Good. Thanks, man. So, yeah, if we've got people that are on, I'd love to see your comments. If you just chime in, let us know that you are hanging out with us, as this is my first live podcast. I don't know exactly what episode we're at. I think we're at episode 40 or something like that, Drew, but it's an exciting one for me because it's relevant and it's timely. And if I was ever going to do a live podcast, now would be the time. So let me just start. I have to start recording one other area here. This is the Zoom H5 for the digital voice, so that I get the disc jockey voice. You're going to sound like the distant telephone interviewee.
Perfect.
Yeah, exactly. It's my show, right? I mean,
well, and I'm the guinea pig for the live show too, right?
You are, and don't think I don't appreciate your guinea piggery. I'm pretty sure that's a term. Okay, so I'm going to do a basic welcome, just as I would on any show, and we'll just jump in. We've got people with us live right now. So here we go. So, hi, everybody. This is Coach Bill Hart with All In with Coach Bill Hart, and this happens to be our first live show, and I am super excited to bring on someone who I have known for how many years, Drew? Have you been with Building Champions? 9 years?
9, yeah.
Yep. And Drew is a fellow coach, and we could leave it at that, except it doesn't stop there. He also happens to be a physician, an ER physician, at a major trauma and medical center in Southern California. I'll let you identify that if you want to, and if you don't, that's fine. Also a senior partner in his own emergency medical group and an expert witness. Have I reasonably described all of that?
Yeah, that's good.
Yeah. And the thing that I love about Drew, and what drew me to Drew, come on, it was there. I took the shot. Why wouldn't I? Is that not only are you wicked smart, which is always very attractive to me, but you, as I recall, had a full ride water polo scholarship. Is that not true?
Yes.
At Stanford?
That's correct.
I think that's a pretty big deal, man. I think that's a pretty big deal. So that just tells me a little bit about your character, Drew, and your grit. And then when you joined us as a coach, I just thought this is phenomenal that we have a physician who is a coach at Building Champions. And so anyway, you and I have shared a lot of fun things, from luggage to technology over the years, and we share some of that. We geek out on some of the same things. So it's fun to hang out with you. But today I'm talking to Dr. Drew, and no, not that Dr. Drew, the original Dr. Drew. We'll just go there, right? Yeah. Because, man, you are on the front lines. You are masked up, gloved up, hopefully shielded up, and dealing with this beast that we call COVID-19 right now. And so here's what I want to say in the setup, and then I want to listen to you, because I think I can represent most viewers or listeners right now, Drew, by saying it seems to me just like politics on this, right? It's red state, blue state, which doesn't necessarily break down that way, but there's one camp that's like, it's just the flu. What's the big deal? And then there's another camp that's like, it's Armageddon and there's nothing that's going to be left but cockroaches. And there, it just seems to be these two extremes. And it gets awkward now where if somebody posts something about being outside on social media, somebody else comes in right behind it and says, what are you doing? You're putting us all at risk. And so it's just, are you running into that polarization right now?
Yes. And I think specifically regarding the, do we open up everything right away because everybody's losing their jobs, or all that kind of shuffling of when is it going to happen and how are they going to do it? But I think it's, well, let me see how to answer that. It's not the flu.
Yeah.
Put shortly, the flu probably has a mortality rate in the 0.2%, range. Probably 20,000 people die of the flu. It's very predictable who dies of the flu, whether we like it or not. It's usually a complication from the flu that we see in an older age group.
Yep.
This is not the flu. We're looking at probably 10 times higher mortality rate than the flu, probably in the range of 1%, depending on what age group and what comorbidities you have, meaning high blood pressure, diabetes, other things. So we're dealing with a new virus, a novel new virus we've never been exposed to or seen before. So our bodies are doing funky things with it.
Yeah.
Statistically, a good news thing, I guess, is that it's somewhat predictable. We can statistically predict that if you are, 65 to 75, you probably have a higher mortality rate. If you're 75 to 85, it's higher than that. 85 and beyond, it's even higher. That's statistically comforting to us, not in those categories. But what we're seeing are the random 50-year-old firemen dying and the random 42-year-old dads dying. We're seeing the healthy individuals randomly picked out from this thing and getting killed. So that's what makes it frightening as an ER doctor to show up at work, because last year when the flu hit, I knew I'm not in the age group that's going to get the flu, that's going to kill me. So have at it. Let me have it. Yeah. But I now am in an age group and it doesn't really matter which, that you will potentially be the guy that gets a bad case of it. Now, if you play the numbers and you play the statistics, vast majority of us, probably more like in the 90%, will do fine with it. In fact, the research is showing more and more that there's probably 25% or higher range of us that are getting it and don't even know we've got it. So that's good news, because that means that some percentage of us are going to get this and not have any symptoms, and yay, we got it, and so what? Right. The other good news with that is that that's going to, as you can already do the numbers, that's lowering what we're really seeing at the Hopkins website, terror site, right? That shows like how many people have it and how many people are dying. That means that denominator number is probably way off. Yeah. Meaning that when we see in the US, the mortality rate at 5% is probably more like, 1% or, because the denominator is probably much higher than what we're really seeing. Yeah. Which is one of the reasons why in South Korea and in Germany, they did all these aggressive testing, because it reduces all of our anxiety when we see that the mortality rate is actually more like 1%. And it gives us more information. So that's why we've been in that place as US physicians, a little frustrated that we aren't aggressively testing everybody, a little frustrated or maybe even angry that we don't have PPEs to protect all of us. Yeah. Those are some of the initial thoughts when you ask that question.
Yeah, well, I appreciate that, man. And I'm getting comments coming on that are, one guy says, wrong, 60,000 flu deaths last year. Somebody else says the stats aren't anything like you're saying. So I know you well enough to know, Drew, that you're not going to get defensive over that. But I would like you to react to that. Talk to me about, you talked about Johns Hopkins and you didn't mention World Health, but, there are specific places where we can go to get data such as it is being reported right now. But as you also said, it's all in flux right now. Like, this is all brand new. At some point, we're going to look back on this event in the rearview mirror, and we'll have data that will have settled out, and we'll all be much better educated. But as you're living through it right now, I mean, is that kind of what's happening? Is this data is like all over the place?
Yeah, and so I really appreciate comments of like, you're wrong, it's 20,000 to 60,000. Yeah, I mean, I don't know, that's off the top of my head, but I do know that this virus, if you let it go wildfire, you will see places like New York City, places like Italy, the country of Italy, places that will erupt, and it will just go to a point where we're not looking at 20,000 or 60,000 deaths. We're going to look at hundreds of thousands of deaths.
Yeah.
So there's a reason why, the government decided that we need to put on quarantine. It's not just like, oh, let's just do this lightly. And the guy running it, Fauci. Every doctor I know some infectious disease guys that really think this is the guy. I mean, he's very well respected. He knows his stuff. And if the government officials listen to a guy like him with his team, we're probably going to reduce some of the deaths that we're seeing. Yeah. And I would also agree that, maybe the flu is 60,000 and it's not 20 or whatever the number is. But this thing has this COVID has the capacity to shoot up to millions. It just has it. We've seen it. We saw it hit a nursing home in Seattle and it just blew up. We could see that, and that's why we're going to probably be practicing social distancing for a while. Probably going to need to do this for 6 months or a year or even longer, and that's what we are all trying to settle into. Additionally, we don't know the numbers. The numbers are all over the map. It's a lot of the dust has not settled.
Yeah, so I hear that, and as you know, my son-in-law is a physician, and he's in an urgent care, so not the intensity of what you've got, but he sees flu patients every year like you do, and he's also wicked smart like you are, and I think he agrees with you on everything that you've just said. And I think we've got to listen to you guys on the front lines and reading the papers that you're reading and look at the data that you're looking at. So Drew, when we think about these areas where we've had just massive morbidity in New York City and Italy, two great examples. I mean, is it just as obvious as the proximity and density? Is that the first issue, and less so in Idaho and Wyoming for obvious reasons? Is that, I don't want to be like super fundamental here, but if I got more people all around me, am I not dramatically increasing the odds of infection?
It's that, and it's the not following the rules, and it's the age group that starts with or clusters in. So if you've got an elderly age group that doesn't follow any, not washing their hands, not touching their face. You notice I haven't touched my face yet so far in our call.
Good point. Good point. Yep.
And you're staying away from people some distance, which we can talk about if you want. Then your risk of getting this thing drops to close to zero.
Yeah.
So if you're not following the rules, you're in that age group and you're living close together, this thing can really erupt.
Yeah. Yep. So let's talk about distance. I just saw a tease on the news this morning, and then I wasn't able to see it about I don't know if you saw it or not. I doubt that you would have, but it was a demonstration of a cough, and somehow they had lit up the particles that were coming out, and they were showing it with a dummy and then a human there, and they were even saying, I think the implication of this show or this segment was that 6 feet may not be enough. So talk to us a little bit about distancing.
If you are outside, then 6 feet is probably enough. I mean, I've been actually listening. There's a physicist out of MIT and a couple infectious disease people, and there's a couple interesting podcasts where they talk in more detail about this. And yes, if you are out in nature, outside, then even if you have the virus, it's probably going to dissolve into the air pretty rapidly. So 6 feet is probably fine in an outside open area. But like you just mentioned, if I am in my room right now and you come in and you sneeze, it's 25 feet. It's 30 feet. Yes.
Really?
A sneeze has been researched in a lab, and it's probably 25 feet. Not probably, it is 25 feet. That's kind of the number. If you cough, so the sneeze is the extreme, that's 25 feet. A cough, you can just shrink, subtract some feet footage from there. And then if I'm breathing really heavy or singing a song, then you'd subtract from there. And if I'm quietly breathing and not talking, then it's probably close to 0 feet. So that's why the CDC and the kind of US has kind of said, well, let's consider more push to wear a mask.
Yeah.
The mask has 2 benefits. One is if I'm carrying around the virus and I don't know it yet, which is another problem with this COVID, is that we're seeing 2 to 3 days before you actually get symptoms, you're probably spreading the virus. So slap a mask on, and if I sneeze, cough, or breathe heavy, it just reduces that. It instead of 25 feet, we're shrinking the distance.
Yeah.
It's also, secondly, reminding me not to touch my face, which is a good secondary thing.
Yeah.
So the 3 things, look, the way we're going to get this thing is by touching surfaces, which is droplet spread, which is where the flu is the predominant way you get the flu.
Yeah.
And the predominant way you're going to get COVID is by touching a surface with a hand and then touching your face.
Yep.
So if you eliminate touching your face and you keep your hands clean, you have you're really into the low percentage risk. And then the other risk is obviously someone with it that is near you for a period of time long enough that those aerosolized particles get onto your face and get into your mucous membranes, then there is a potential risk that you'll get it.
Yeah. Yeah. So I just think that's good, right? And my hope is that the vast majority of Americans see this as new best practices moving forward. Nobody loves it, but if that's the thing that's accepted, I can just tell you that my social media feeds, plural, are full of mask advertisements, right? Some of it probably bogus and some of them probably legit. And I'm seeing everything, Drew, from the bandana kind of thing that you can pull up over your face that's made of something other than cotton. I had heard that cotton was the ideal fabric, but I'd love to hear you comment on that, to the, full-on custom masks with a branding on it, and some even have a charcoal filter insert. And we're seeing everything, right? So, the Hannibal Lecter version might be attractive, but talk to us about masks. Like, what do we need to know?
Any mask you wear will give you some sense of protection from you spreading the virus out to the world and from you touching your face.
Yeah.
But if you're really serious and you're working in a healthcare environment and you don't want this thing and you're going into a room with somebody who potentially has it, then you really have to look at the N95 mask, right, which is really called a respirator, because you're sealing your face completely with the mask, and the mask has a special filter so that it catches, well over 95% of the different viruses and infections you can have.
Okay, so that's good that's a good distinction for us to be aware of, though. And honestly, I had bought, when we had the wildfires out here in Southern California a year or maybe 2 ago, I have asthma and COPD. So I had bought some N95 respirators, and I have a box of them in the garage. And I mentioned it to my son-in-law and said, dude, when it's time, like, they're here. You let me know if you need them. So he will take them when he needs them. And by the way, if you need them, let me know and I'll send them to you if it gets to that. But I think it's important for most of us to know that, okay, what I'm hearing you say is the real truth of the matter is the mask is not what we think is a defensive weapon against what might be out there. It's really more an offensive weapon about us not pushing it out. And as you told me a couple of weeks ago, it's really not designed, but an unintended consequence that's positive is it reminds me not to touch my face. Right?
I think that's largely accurate, although there's probably some defensive measure. Obviously, if you cough at me, maybe that droplet will catch on the mask and absorb there versus getting in. But, so it's the only caveat to mask wearage is that you get a lot of people doing this, taking the mask and putting it on their neck, or a lot of people taking it off. Well, as soon as if you're touching the outside of it, or you touch it here, like what people will say is just imagine the outside of the mask has wet red paint on it. And that wet paint is the virus. So you got to be mindful that you're touching it, your hands now got the virus on it. You go like this, your whole neck has the virus on it, which leads to getting it into your face. So just, when you take the mask off, if you can get rid of it, great. That makes it really simple. But if you want to reuse it, be aware that if you did indeed go to the grocery store and have somebody cough on it, then that's, potentially a virus.
I love I hate it, but it's such a powerful visual of the wet red paint. I think listeners and viewers will take that moving forward. I had not thought about that. We've got a couple of surgical masks, I guess, right? The little folded ones. Is that what they are? That Tony and I got from our son-in-law from when we're out and about now, because I've ordered a bunch of, like cotton ones, but nothing's arrived yet, of course. So I've got those, but that's really good to know, Drew, because I don't know that I would have consciously given thought to the fact that, I could have created my own little hot zone here. And now I'm actually infecting myself with it because it's collected it. And now I'm touching it, and then I touch my face. Which
we speculate that that's largely how a lot of healthcare providers are getting this thing.
Really?
Is because if you have a lot of PPEs, let's say you have an infinite supply of N95 respirator masks, then I come to work, I put one on, I take it off, I throw it out, I put another one on, and I'm never reinfecting myself. But if you only get one, here's your one mask that you have to use for a week, then that puts you at higher risk for you self-inoculating yourself, so to speak. Like the virus is on this, and then you're trying to clean it, and you're at risk of infecting yourself.
Yeah, makes total sense. So let me shift gears a little bit with you. I'd like to go two places. One is I'd like to go to your current reality. You know how we talk about that at Building Champions, right? So I'm bifocal vision. Drew is looking down at current reality, but he's also looking through the top of his lenses out at your, let's just say, I was going to say idealized future. Let's look at what you see as a realistic future based on what you see now. Let's talk about your current situation, though. I really have no idea. Like, does this mean you're working more hours, longer shifts, or are they the normal shifts? How are you doing personally, and what do your days and nights look like right now?
So a fascinating question, because in early March, kind of late February, early March, we were ramping up. I mean, seeing all kinds of this coughing, fever, illness that we were like, is this it? And, there's even some research coming out that maybe this thing was floating around in December. So it's like, are we seeing this? I mean, I, in fact, remember one shift where I went out to the waiting room because we had no beds and we were so kind of influxed with all these respiratory symptoms that I kind of talked to 2 or 3 patients and sat them all down together. And I was fully masked and everything and said, we think you have it. We don't have testing yet. So we're pretty sure you have the COVID. Here's our contact information. Here's to keep in touch. Let's, see how you do. And I remember doing that multiple times because we were so busy. And then the quarantine hit in California, and all of a sudden, all the non-COVID people disappeared. I mean, I don't know where all the heart attacks, appendectomy, appendicitis and kidney stones, they all kind of disappeared. It was really weird. And so we basically, instead of seeing, I don't know, like let's just imagine you see 100 patients a day. Instead, we're seeing 50. We've dropped by 50%.
Wow.
And we now have everything ready for the big surge. But in fact, we're probably seeing consistent COVID, but not an overwhelming amount. So
interesting.
My little tiny world picture is that the curve is flattened.
Wow.
And I have heard from other emergency physicians in other regions of the country that if you are in a community setting, not Detroit, not New Orleans, not these crazy hotspots, that you are experiencing the same thing, that you're actually contracted and you're kind of like waiting for something to erupt. Now, you asked about, that's kind of current reality, is just kind of like, are we sitting on a time bomb that's going to, blow up on us?
Right.
And then kind of a future state in the next couple, maybe 30 days is we're thinking they're going to open up some stuff and then we're going to see another curve. We've seen a curve and it kind of, at least in our neck of the woods, is relatively flat. We kind of predict we're going to see another curve that maybe even we just don't. I mean, that's the thing. Everybody's got an opinion, but this is a call it. This is a once in a millennial, once in 100-year, once in a century kind of thing. So anybody who wants to do a prediction, go for it. But is it going to be right? Probably. So I'd like to say I'm predicting and see a hump, and then we'll see a little small humps, and then we'll be off this. But I crystal ball.
Yeah, and then far out. How far out do you see a vaccine realistically?
Well, recently in the last week, I heard that there were encouraging things, and we probably are going to first off pull off a vaccine, which is always in question. It sounds like we ideally will pull one off. It sounds like that will happen. And then ideally, it's not going to be 18 months. It's going to be 12. So if we could get to 12 months and we could say, yeah, we're going to actually have something, then that would be fabulous. I think the way this thing trickles out and ends is a couple ways. One is, maybe it'll be like the flu where it's seasonal and where we actually, in the flu, we see this kind of curve and then it starts piddling out. That's what's happened for years with the flu. And maybe this will have some of that. Number two, people get it, that we have what we call herd immunity, where enough people get it. Like, if I'm in the room with you and your whole family had it, I'm not going to get it if I hang out with you guys, So herd immunity. And then the third piece would be that there is indeed a vaccine. We start vaccinating everybody and then it goes away. So
interesting. Yeah, interesting, man. So it's funny, man. I was just south of you in Torrey Pines at the end of February, and I had was it just before that? Like the week before that, so maybe mid-February, I got the chills, which I never get. It was the weirdest feeling. It was like the temperature was fine and I was chilled and I was shaking just slightly, but I could feel it. And then I came down with what felt like the flu for about 36 hours. And then I was fine with a cough that lasted for probably 6 weeks. Is there a chance that I had it?
Yep, definitely. And I hear this all the time with my clients and with my, oh, I had this thing. But granted, the caveat is we all have this thing during this season, right? We all get viruses and coughs. And so everybody's kind of thinking, oh, I think I had it. It was this. Maybe.
Right.
But the answer to your question is, did you not have it? No, quite possibly you could have had it.
Interesting.
But we won't know. That's the next wave of this, and it's starting to ramp up, is antibody testing.
Yeah.
One of my partners got symptoms of COVID. We sent him home, and he recovered. And then we got this rapid antibody test that is starting to be produced, and he took it, and he has IgM antibodies to COVID. And so, what does that mean? That's the other thing. Like, if we can confirm that means you have immunity, and then that immunity lasts more than a couple of weeks, right? I mean, maybe it lasts 6 months, or maybe it lasts for years. We don't know.
Yeah.
If we can confirm those two things, then we should have so many darn tests, and assuming the test is accurate, then we should mass produce those if we can confirm all that. And then everybody gets tested, and then everybody who has antibodies goes back to work. So that's really to me, in the next 30 to 60 days would be really amazing.
Has that battle been fought before in the infectious disease world?
Not that comes to mind that we.
That's amazing, man.
Yeah, Well, I mean, obviously that battle's been fought before. We have definitely through many, many years known that, you get a blood test if you've had, and we can
Sure.
check to see if you have antibodies for certain things. But
Yep.
this is so novel that we'd have the unanswered questions of, if you have had it and you get antibodies, what does that mean? Does that mean
Right.
you've got immunity? How long does that mean you have immunity? Et cetera, et cetera.
Yeah.
Again, reading the tea leaves and what the data is showing is
No, I know, man. I know.
you probably have immunity. You
Yeah.
probably have immunity for a good 6 months, and that's good news. And if we can
That
confirm that, then we can get people back to work, and then we can have an understanding of how many people have this. So that would be really great.
So when you, I love that conversation, and you've helped me to understand it because I've seen mention of it, and I typically I get bits and pieces, and I just don't go in because I try and steer my clients away from the news. So I try and stay away from the news. I think you get your facts and you move on with your life, right? You can obsess and throw yourself into a worse situation and create more stress and lower your resistance, I feel, by watching too much news, whichever channel you watch. But my question for you now is something you may not know, but I'm just curious. When we think about the antibodies, I just saw this report the other day. I don't know if you saw this visual that I posted, this infographic on the huge amount of money that Google is spending on COVID. And I want to say it was 600 or 800 million, if I'm not mistaken. And then Facebook was like 200 some odd million, and Apple was 150 million or something. Like, what are they spending money on? What is that? Is it equipment? Is it PPEs? Is it research? Is it all of that? What are they doing?
I don't know, but I would love, I have my list. I would love that it would be N95s to keep us, supplied.
Yep.
And other PPEs. I would love that it would be on vaccine research. I would love that it would be on confirming that if you've had this thing, that this test will, confirm it, and that it will, that we know that you have immunity.
Yeah.
Those are the things that rattle off my head. Those would be great. I'm assuming that's where that money is going to. That would be my guess.
Good. Well, so let's wrap it up with this question. And so this is from my friend Drew, who happens to be a physician in this moment in time. And you took an oath, and you're stepping into the breach every day. And when you and I spoke a few weeks ago, you referred to your hot zones that you saw, and it was the hospital, and it's your car, right? And we're seeing now, what am I looking for? RVs being donated to people so that doctors and nurses can stay in them on their property at home, but not be in the house. So with all of that going on, whether that's too extreme or the perfect thing, or just the PPEs and the N95s that you need, we're seeing a lot of love right now, which is awesome. You guys are getting a lot of love right now. But tell us what you need. You've got people watching and listening right now. What do you need? How can we be helpful?
Obviously, I think we're still in that kind of, I think we're starting to see an influx of supplies. And I think how this happens, right? I'm a little embarrassed that this was the US and we didn't have the supplies, but what'll happen? We'll have too many ventilators and too much, we're gonna be like hemorrhaging this stuff in like in 3 months, we're gonna be like, we got way too much. Yeah. So we're starting to see that influx, and that will help reduce our risk if we have enough supplies. My current hospital, my current ER group, we've got supplies, so we're doing okay.
Good.
So I think that's one way to kind of help support. The other way is to be mindful. We had a lot of people with the sniffles that would come in and would, get themselves exposed to COVID and would insist that we get a test, and we don't have the test. Yeah. We're just now starting to get the test. Yeah. So don't go to your ER. Go to your ER if you've got chest pain or you've got abdominal pain. Those are things you need to go to the ER for. And that's what we're here for. And if you have COVID and you're short of breath, come to the ER. Good. And that's it. That's the reason to be in our ER.
Makes sense.
And I guess I was going to add, I've gone through the stages of grief. And I think we all are going through the stage of grief. We don't just go through grief with a death. We go through grief when there's a change.
Totally.
And this is a radical change. So if you feel depressed, if you feel angry, if you feel all these stages of grief, you're not alone. We're all doing it. And I was like 3 weeks ago, I was really feeling the anger and the stress and now I'm like, this is a new normal, and I've kind of gone to acceptance, right?
Yeah.
And so, okay, I got to shift. As soon as I walk into my car, hot zone, and I got this whole ritual. Will that reduce my risk of getting it? I hope, but it definitely has reduced my anxiety level because I've kind of said, this is my new normal. I'm probably going to have to wear this respirator thingy for probably 6 months to a year, and that's just going to be the way it is.
Yep. Well, I appreciate it, Drew, and I know you're a busy guy, and right about now you could probably be taking a nap or working out or doing something other than this. So I appreciate you doing it. But with my tribe and the crew that I'm connected to out there, I know that you've answered questions. I think you've given context to the polarizing questions and helping people to just understand it from a more scientific view and a practical view. So you've been enormously helpful. And, I don't want to miss the opportunity to let people know that you're a coach, and you coach physicians, and you coach all kinds of people that I don't coach. So I just want to put it out there that I don't even know what your availability is right now, but I can tell you this, you guys, if you're looking for one of the greatest minds in coaching, period, it's Drew. And if you want somebody to challenge you who has more certifications in coaching than anybody at Building Champions, I think I can say that bar none. Like you're a freak with that stuff. Every time I turn around, it's like, oh yeah, Drew's got that. Oh, Drew's figured that out. Oh, Drew's already doing that. Drew wrote a book on that. So whatever your hunger might be, maybe not at this moment, but maybe 30, 60 days down the road, Drew might be a guy that you'd want to reach out to.
Yeah. Oh, thank you, Bill. I mean, I'd be honored. This is my calling. I love coaching. I love to help leaders just turn the volume up and get better at who they are and what they do. And then, Bill, I'm honored to be on your show. Get me back anytime you want. I wish I could have been more clear, but this is just really this once in a 100-year kind of thing. So we just have to kind of sit tight and be patient.
Yeah.
And statistically, we're all going to get through this, and we're all going to be, learn from it and grow from it. So.
Yeah. So final advice: wash your hands. Don't touch your face. Wear a mask. Mask has that red paint.
Stay away from people. Yeah.
Stay away from people. Move to Montana.
Yeah, exactly.
All right, buddy. I appreciate you so much. God bless you. Stay safe. And maybe in 30 to 60 days, we'll do this again and look in the rearview mirror and see where we're at and see what we learn.
Yeah. All right, good.
Appreciate you, Drew.
Thank you.
Thanks, man.